This is a true statement. I once tried going out with a lady dentist, but she brushed me off. Don't worry, it's her floss. Thank you. Dr. Thompson.
I don't know if you have these in your community, but I think you do because you live close to me. I got one of these in the mail, and it said that I could get my teeth cleaned, I could have an exam by the doctor, I could get the dangerous bacteria that live near my teeth removed, and I could have any necessary x-rays. And the cost of the dental treatment was $258.50, and that was the coupon price. And then I flipped it over and I learned it was for my cat. And I started to think that, you know, even in my practice, I wasn't doing as good a job as the veterinarians were at teaching their patients about the value of removing bad bacteria around the teeth and good oral health. So the question is, how can conditions in the mouth affect whole body health? And I can tell you it's a lot of different ways. It started in 2004. I think everybody's familiar with the Time magazine on inflammation and the significant impact that inflammation has on our health. And then it's carried on to a little bit later with the Inflammation Syndrome book by Jack Callum. And what this book talks about is how it's a constellation of inflammatory issues that's really taken us down and causing big disease for us. And in fact, cardiovascular disease is kind of being redefined as a constellation of inflammatory vessels and inflammatory issues. And so arthritis, periodontitis, which is gum disease, and all these diseases kind of compile on each other, and when they do, it causes great problems for the vascular tree. So all these books, you're familiar with one of them. This is Dr. Kahn's book right here, the Whole Heart Solution, and I'm going to have a couple of these free for some people today, but and I'll tell you how to get them in a minute. But all of these doctors I know personally, and I can tell you that they all have one thing in common, and that they want to fight all types of inflammation, whether it comes from health issues, whether it comes from the oral cavity, but they all have a significant understanding of the importance of good oral health. More recently, the author of this book, Beat the Heart Attack Gene, Brad Bale and Amy Doneen, travel around the country and they teach physicians, and this is where Joel and our paths cross, teach physicians about the significance of preventative cardiology. No longer doing bypass grafts and other things like that. They're moving more into plant-based nutrition and other healthy avenues. In fact, they've kind of coined a new term, and it's called arteriology. And arteriology is really the study of the vascular wall. I know that Caldwell Esselstyn's been here, and this is just a little bit of science, but this is a cutaway of an artery. And the artery is very healthy on this end, and the artery is very sick on this end. And what happens along the way, the continuum of disease, if you will, as fat builds up in the vessel walls, what happens is there's certain biomarkers that are given off, and some of those biomarkers are very easy to measure. And so Dr. Kahn can measure those, and those biomarkers are basically a gauge of how much inflammation is floating around in the person's system. And the beauty is, if we can control the inflammation much before we have a breach in the skin lining, the protective skin lining of the vessel, before we have a break in that and cause a heart attack and stroke, we can actually see these biomarkers raised, and we can prevent this from happening. And Brad Bale and Amy Doneen think that all heart attacks and strokes can be prevented. And that's really what we're trying to do, because you know, everyone knows somebody who has a personal story that either watched a family member or somebody that they care about or know got carried away in an ambulance because they had a heart attack or a stroke. In fact, in the United States, we have a new Vietnam about every month. We lose that many people to heart attack and stroke, and we don't seem to be doing the things that we need to do to take care of it. I want to share with you what the dentist role can do, because it's pretty significant. So this is a graphic illustration about gum disease, and how gum disease and the bacteria that cause gum disease can actually cruise through the body and cause all kinds of things. Different cancers, it can affect our end organ systems, it can affect us in a lot of different ways. And I'm going to, in the biggest way that it can affect us is irritate the vascular system, the 60,000 miles of blood vessels that we have running through our body, and irritation and drive up inflammation. So I also had the privilege to publish a couple professional pieces, and I I have some of my colleagues are here that I'll introduce at the end tonight. But there's a lot of these little informational pieces, and there's some stuff out in the back table I have for you if you'd be interested. But these little pieces about how inflammation affects the vascular health. It's quite an interesting science. So my practice really got reshaped from just repairing teeth and looking at teeth into a very different way, and it was the integration of the oral conditions, being aware of the oral conditions that cause whole body issues, and then working with physicians that can help me manage the patient's health much more carefully. So we want to definitely create these beautiful smiles. There's no question about that. But what we really want is we want the person who has that beautiful smile to be healthy. So this is the paradigm that we have to get over, because this is what we learned and this is how we learned it. And we learned this about doctors. But I can tell you that today, your dentist can be hugely important in your health, because most people see their dentist quite a bit more regularly than they see their physician. And if the dentist has an awareness of what to look for, it can be amazing what they can discover. And it starts by assessing disease, and I'm going to break it down into 6 kind of key areas and give you just a little taste of each one. And these are outlined out in the back as well. But gum disease, we call that periodontitis. That's an inflammation of the periodontium. Gum disease, cavities. Everyone's had somebody or knows somebody who's had a cavity in their tooth. And then bite disease, oral cancer, sleep apnea is a huge deal. And then this other one called biocorrosion, which you might not be too familiar with. But biocorrosion is something that can be easily detectable even with your fingernail. And I'll show you how to do that. So having one of these conditions can significantly affect your health, there's no question. And this makes no difference about your diet. Because I can tell you that I've done lots of studies and tried to look just purely at nutrition, but it's a little bit more than that, because some of these diseases are caused by bacteria. And if you have them, you have them. In addition to these key areas, we're looking at now teaching dentists how to become more aware of early heart disease detection. And there was a piece in the back about know these top 25 to stay alive, and these are other disease conditions that affect someone's likelihood of having heart disease. In addition to that, we do a lot of yeast management. We have people that have chronic sinusitis and yeast infections from sugar, and so we can manage yeast infections. We're also concerned about hydration, nutrition, exercise, stress, these kinds of things. But I'm going to touch a little bit on the exposure to pollutants and mercury. There's some interesting things we can do with determining how much mercury you have in your body, if it's hurting you or not hurting you. And then proper supplementation. I have several patients who come in and I would ask them what they're taking, and they say, well, I'm taking, one of the things they're taking is copper. I said, well, why are you taking copper? And they would say, well, my physician told me about 10 years ago I need to take copper. So, they're still taking copper. So we have to measure some of these vitamins and minerals that we're taking, and if we need to know when to get on them and when to get off them, but we don't want people taking 30, 40 pills a day if they don't have to. So gum disease, it really starts with these harmful bacteria that live around the teeth. These are transmissible diseases, by the way. So if you have somebody in if you don't have gum disease and you meet up with somebody who does, chances are there's a good chance that you're going to be exposed to those bacteria. And gum disease can also contribute to heart disease and a whole list of body ailments, and the jury's still out on how many people have this, but I can tell you a lot of Americans, and the statistics show somewhere upwards of 50% have this issue or have problems with it at some time in their life. But this is the key. Without a certain type of bacteria and a certain number of bacteria, the disease just won't happen. So in our practice, we focused really, really hard on controlling the microbial load or the bacterial load, because we want to make sure that we can manage the cumulative inflammatory burden that comes from all this stuff that lives in the mouth. So this is a cutaway of the teeth. This is the tooth, obviously, and this is the gum. And so here's the root inside. If you could look inside the bone, that's what you would see. And what I'm going to do is I'm going to focus the next few minutes right in this area right here. And this is the tooth, this is the root, here's the bone that holds the tooth in. And so this is about just a little bit more science, but not much. And what happens in that area, so this is the tooth, this is the root, this is the bone holding the tooth in the jaw or in the top of the head. What happens is the bacteria invade that sulcus or that crevice, that same one that you get a popcorn hull stuck in. The bacteria invade that crevice, and what they do, they advance as they get the crevice gets deeper and deeper, and pretty soon the bacteria have a freeway to the bloodstream. And they just kind of cruise through the whole system, and they stick in arteries, they stick all over the place, and they also eat away the bone that holds the teeth in. And this is what people think happens. You typically would your teeth would get loose over time, you'd lose your teeth, and we make dentures. Well, I can tell you that doesn't have to happen anymore, and we can stop that if we detect it. What we have in the practice and what we've been using for 6 or 7 years is a sophisticated test that tells us not only the type of bacteria that live there, but the concentration of bacteria that live there. And the dentists that are here with me in the room know how to use this test. And this test can give us a more targeted approach to therapy, so we can specifically target the bacteria population that's causing the problem for our patients. And what is significant about gum disease and what makes one person have it and another person not have it is the microbial makeup. But even more important than the microbial makeup, it's the person's susceptibility to the disease. You've all been on an airplane or a bus or in some public place where somebody's coughing and hacking and you're with somebody that you know, and they get the cold and you don't get the cold. Well, why is that? It's because we have different susceptibilities to disease, and some of us are very vulnerable and some of us are not. So we call those host modifying factors, basically your immune strength and whether you can fight it off or not. And so these are the two big things that make a difference of whether you'll express the disease or if you won't express the disease. So this is an example of a person that has a lot of cheesy plaque around the teeth, and you can see that, and there's a red band around the teeth. This person's just not a good brusher right now. And what happens to him is if I do a bacteria test, I can find very harmful bacteria. But guess what? From a dentist standpoint, and you might not be able to recognize this, but I can tell you there's no bone loss or there's no harm done to this guy's teeth right now, only to his blood system. This person's 15 years old. This person right here has teeth that are much longer. This is the longer in the tooth issue, and the gum used to be here, and the gum used to be here, and the gum used to be here. And what happened over this person's lifetime is the bacteria have done a tremendous job eating away the bone, making the teeth stick out of the gum higher. Now, the difference between this person and the last person is this person is now stable and perfectly healthy and has been for 15 years. Disease has been managed, it's basically been stabilized, and so this person is in a safer zone right now than the other person, except this person's also in her late 70s and there's more advanced, this is past disease that's now stable. So again, these periodontal disease that can affect your heart and your body, as I said earlier, and these bacteria that destroy the teeth can also cause havoc elsewhere. So we have clear evidence in Dr. Kahn and in the physician world, we have clear evidence to show that if you have periodontal disease, it can affect the elasticity, the stretchiness of the blood vessels, and that drives up blood pressure. It can also create a dysfunctional skin lining, internal skin lining of the vessel, and that's very dangerous because that's what they think now causes heart attacks and strokes. It's a break in the endothelium, where the endothelium basically is dysfunctional. And then the HDL cholesterol, that's our good cholesterol, and it acts like a dump truck, and it parks the bad stuff in a safe place, and the ability for it to park the bad stuff in a safe place is called efflux, and it affects HDL efflux. It also affects the atheroma process. And the atheroma process, atheroma is a word for the fat buildup inside the vessel. So that's what these gum disease bacteria do. And some of those gum disease bacteria do it more than others, and that's the significance of that chart that we use in that testing process. And then they obviously drive biomarkers. These are measurable biomarkers that we can look at as a gauge for how healthy our patient is or isn't intravascularly. So here's the top 25 that's on the table. I think there's a few copies. You're welcome to have them, if you will. But when you look at some of these things that are concomitant risk factors for cardiovascular disease, firemen have the highest risk in career fields. Things like restless leg, post-breast cancer patients, people who are exposed to heavy metals and lead, gout, obstructive sleep apnea, arthritis, migraine, headaches. I mean, a lot of these things. So when we have patients that come in and they have some of this stuff on their health history, I'm all of a sudden starting to get a little bit suspicious about the rest of their health. If they have these things and periodontal disease, and some of these other things that I'm going to talk to you about, then we get really serious about talking to them about making some health changes. So And that brings me to Dr. Khan with in his book, and Dr. Khan obviously wants everyone to have healthy vessels, and that's where our paths cross. So just to give you a real quick example of how this works in practice, this is a 53-year-old male. He comes in, and he has, this is the graphic roadmap that we use in the dentist office. Have any of you ever had periodontal charting or gum mapping where the hygienist is calling off this series of numbers? This is the graphic roadmap that's kind of produced from that visit. And the red dots are just bleeding areas. These are areas where there's excess inflammation. So this tells us this patient's not stable. I've put together a really detailed disinfection protocol that allows me to take these patients to this kind of stability with zero bleeding, and we can get increase in their health as well. And in addition, this is what the teeth look like. You can see that just like the other patient, some of the gum is shrinking away. And if you go home and look in the mirror and look at where the gum level is on the teeth, if you see some root exposed, then you know maybe you've had some incidents or you might have some issue with some gum disease. And this is the bacteria chart before we started to treat him. And you can see just from the colors that there's bacteria present and that there's a certain number of them there. And then this is the post-treatment chart. So you can see from the post-treatment chart that the bacteria concentration is significantly less, and this is a much healthier environment for this person. We can now take this chart, we can measure it every couple years, and we can keep this patient, actually this patient doing great work at home, can keep themselves very healthy and change the microbial profile. And the plants and foods that we eat have a tremendous impact on this microbial profile as well once we get it stabilized. This patient right here, this is an x-ray, and if you look at the bottom right-hand side, you'll see there's some teeth missing. And if she were sitting in front of you and looked in her mouth, this is what it looks like. There's an area where teeth are missing, so this patient's going to have some implants. A lot of you in the audience may have had a prosthetic hip or a shoulder or maybe even a dental implant. But you know when you go into the hospital, when they do any kind of surgery, you end up with a big orange spot. If the surgery happens to be on your belly, you end up with an orange spot where they do disinfection before they make the incision so that you don't get infected. Well, in fact, in dentistry, we don't maybe do enough of that cleaning, because this is the bacteria profile of this patient before she went and had the implants. So what we think is through a disinfection process, we can then move her from this type of a profile to this type of a profile, and it's a much healthier, cleaner environment for these implants that are going to be surgically placed in the jawbone. It's a much healthier thing. Let's look a little bit about cavities. Cavities come in all shapes and forms, and I can tell you that not everybody gets cavities, and not everybody is going to get cavities in their lifetime. But they come, again, in all shapes and forms. And I don't want to get too graphic, but this is what we see every day in practice. We see small little cavities that are much smaller. We see cavities that are barely detectable. You wouldn't know it without the trained eye. And these are cavities from acid imbalance and other kinds of things that are going on. And then we see cavities where the teeth actually rot off to the gum line. And these people have huge vascular issues and have some other issues along with these decaying teeth. And then we have people that don't brush and the teeth kind of dissolve away. So the cavities presents in a lot of different ways, and it's not always obvious. And this is how it works. Basically, bacteria in the mouth feed on sugars. So that's why you'll see up at the back table a book called Stop Only Sugar. We'd love for our cavity-prone people to switch to xylitol-based sugar or some other healthy sugar. But xylitol would be the one. And then bacteria make acid, and these acids starts to corrode the tooth. And it starts to make a little hole in the tooth, and the enamel gets dissolved away. A lot like if you had just any kind of acid on the tooth, it just dissolves it away. And it actually rots the tooth. If you don't fill this cavity, if you don't stop the bacteria, they'll move and jump to other teeth as well. It'll go from tooth to tooth. So we really want to stop the bacteria as soon as we see it. We have children in the practice that will probably never have cavities, because we see the first earliest sign of a cavity, we get into some very protective mechanisms, and we teach them what to do to keep the bacteria off their teeth so that they don't have to go down that pathway like a lot of us did with big fillings and crowns and bridges and things like that. And so this is kind of how this happens. And if anybody, there's some information pads at the back table, and if anybody emails us and wants any of these little graphic pictures, I'm happy to share them with you. So the therapy strategy for cavities is you want to eliminate the bacteria. That's what we didn't do in our reparative practices. We filled the holes, but we didn't really go after the bacteria. And that's what we do differently now. And then we want to harden and protect the teeth. There's many different ways we can do that. And we want to eliminate the food for the bacteria. That's our diet. We also want to eat more of our plant-based foods, because our plant-based foods make really healthy saliva that comes out of the parotid gland. And the parotid gland, this gland up in your cheek, is very beneficial for the cavity causing, or to protect your mouth from cavities. And you've heard about alkalinizing your diet, having a more alkaline diet. That's another reason why we promote plants. But the bacteria love to live in an acid environment. They just thrive in an acid environment. So if you can alkalinize the environment, you can significantly slow down their growth. So in Joel's book, actually, I thought he was going to talk about it tonight. He didn't really tell me what he was going to say. But nitric oxide is a substance that's made that relaxes our blood vessels. It's a very healthy thing that's made. And actually some bacteria that live on the tongue help make 5% of your body's nitric oxide. And so there's foods that are really rich in nitrates that turn into nitric oxide. And those are the really healthy powerhouse greens. Arugula, kale, bok choy, cabbage, fennel, and spinach, some of these nutrients. And that's what happens. As a matter of fact, I was so excited about this when I saw this in Joel's book. Joel actually writes a recipe about how to put nitrates on a plate. And I think that's what I've given you. It's from page 87 of his book. And Joel, I called Joel and I said, Joel, I really want to pass out your nitrate on a plate recipe to the plant-based nutrition support group. And he said, sure. And then I tasted it. And I'll tell you, it was quite hot. So I cut the cayenne pepper down by half. So other than that, I didn't alter it. But this is Joel's recipe. And what I didn't say in the earlier slide was, if you have cavities, the cavity-causing bacteria will prevent this process from happening. So you could have somebody thinking they're doing the best thing for themselves, eating great food, but if you have some of these oral diseases, it can mitigate some of that. So this is the recipe, and in fact, this is the copy that I think my team was gracious enough to pass out. And I want to just take a second too, and I want to thank my team for being here. Could my staff, could you guys just stand up and just so you can be identified, and then thank you. Any one of these fine people will answer questions for you at the back, and you can hang around and talk with them, and I'm going to introduce a few of my colleagues right at the end. So you have this recipe in front of you, and in fact, this recipe is, this is just one of the reasons why why your dentist would recommend a plant-based diet, but hopefully through the rest of this, you'll hear there's many, many others. And so I have 5 free books that I'm going to give away, and it's somewhat tied to that recipe. So hold on to that recipe, hang on to the end, and I'll tell you who, you might not be able to figure it out, but you'll be able to know at the end who won the books, and then I'd like to personalize them for you before we leave. So only 2 diseases are caused by bacteria. So far I've talked about this bacteria issue. There's only 2 diseases, gum disease, periodontal disease, and cavities. Those are the only 2. All the rest of these things are caused by something else. And so plant-based diets create this more alkaline environment. It's really healthy, create nitric oxide. There's a lot of things that plants do for us from a dental standpoint. Biocorrosion is really a combination of 3 things. And I'm just going to flip to the slide that explains that, but it's from chewing stress, some bending of the teeth, and then acidity from stomach foods, gastric reflux, and sometimes this could be from foods that we eat as well. Some citrus, different acidic foods, so we have to be careful. If we are disease prone, we should maybe rinse with water or xylitol or some kind of thing to get the acid off our teeth. And then the abrasivity from toothpaste. There's many toothpastes that are out that are very, very gritty. They put a lot of grit in the toothpaste, and what happens is it causes gum notching. You can take your fingernail and you can feel up by your gum line, and if you have this gum notching, that's caused by these 3 things kind of acting in combination with each other. And it takes many different forms. Sometimes the tops of the teeth get eroded. This person actually held lemons next to her tooth, and it dissolved the enamel away and actually caused the concavity in the teeth. So if you're eating citrus, you don't want to hold it up in the folds of your cheek or hold it on your teeth. You want to eat it, swallow it, and then neutralize the acid if you can. And so this is called biocorrosion, and it's really the combination of where these things combine. And the issue for us is if we can teach you what to do, if the gum line notching is not too severe and it's not already causing tooth sensitivity, then we can just watch it. We can get you doing the right things, and then we can just watch it. We don't always have to fill it. However, you'll see some that get very deep. You'll see gum line notching that cuts almost halfway into the tooth, and we can isolate that in the operatory, and we can go ahead and we can fill that, and we can protect that tooth from further damage, and that's not too hard to do. This is that more close-up picture of that erosion from lemons, holding lemons in her mouth. So the therapy strategies are to prevent this. We work on the stress from chewing, but we prevent this further damage by getting rid of the offending issues. And then we want to harden or protect the teeth, because we know if you have this biocorrosion, you have an acidic environment in your mouth. The pH of your mouth has to be below 5.5 before minerals start to come out. So if I see anybody with any kind of mineral defects, I know they have some acid issues in their mouth coming from somewhere. And we can help reharden the teeth a lot of different ways. And this is where fluoride is a little controversial. Bite disease, some people really do a lot of damage to the edges of their teeth because they don't line up properly or for some other reason. And there's no question that you can see the damage, and these teeth can be restored, but it's very expensive. As anyone knows, the cost of dentistry is not going down. It's very expensive and time-consuming. However, they can be restored, but this can be prevented. It can also be prevented if you intercept it at an early age. So when we see people with premature wear on their teeth or the wrong kind of wear on their teeth, we want to look at what might be doing that. And you need teeth to eat a healthy diet. All these foods that are healthy to eat, you absolutely need to have good teeth to do that. They're harder to eat, and we know many of our patients that have trouble with their teeth will lean for convenience foods. They'll do things that are easy because that's just what we do. And I can tell you on the bottom right, there's nothing in that bag that resembles an apple. I mean, it just doesn't look like an apple. So we want to really be careful about eating these kinds of foods. So healthy teeth are necessary for good foods. Oral cancer, I'm going to say very little about oral cancer, although interestingly, sometimes people come in and they kind of want to avoid me. They don't want me to do an exam, or they don't want me to come in the room. And sometimes I'll tell them, you know, the teeth, if you don't really care for the teeth, I'm okay with that. But one of the things you got to think about is if you get an oral cancer lesion in your mouth and you have to have a significant disfiguring surgery, it can really be a problem. So at least get a good, thorough oral exam once a year for oral cancer, because it's on the rise. Oral cancer is on the rise, and a lot of the cancers are being found in patients that don't have the traditional lifestyle factors, which typically was smoking and alcohol. And that's what this is here, smoking and alcohol for oral cancer. And then I have something that's a little bit delicate to talk about, and I don't have any pictures, but this is an issue here as well. These kind of lumps and bumps that happen in people's mouths, when we see those, if they don't go away in just a short amount of time, then you really need to have those evaluated. And just like women that are recommended to do self-breast exams, men, always feel your neck, and if you feel any odd lump or bump around your neck that doesn't go away for 3 weeks, please go get it checked out. It could be a lymphoma, or it could be some other kind of issue. So we really want to stay on top of those things. We have a special light in the practice that allows us to look a little bit deeper into skin tissue, so we can see these things before you could see it. That's typically what we try to do. So we have oral cancer screening aids that help us. Although there's nothing better than just our eye. But if we can catch something early, it's very, very helpful. So the therapy strategies for this is just any abnormal lump or bump, give it 3 weeks, go get it checked out. And then early detection is the key, because just like any of these diseases, detecting them early is hard, but treating them is usually easy. Detecting them late, like some of those cavity patients, that's easy, but treating it's almost impossible. Very hard. So please get this looked at early. Sleep risk, I know that you've had someone here talking to your group, but I know there's a lot of new members, so I'll just be really brief. Snoring is one of the key questions that we ask about sleep and sleep risk. And what happens is, and this is out here as well for you if you want to pick one of these up on the way out, but this is about sleep apnea. And sleep apnea is one of the indicators that someone might be apneic is usually snoring. There are some apneics that don't make sounds, but not many. So we ask some screening questions, and then we have a home screening device that we can use that people can wear very inexpensively to basically do a home sleep study. And we want to know the people that are at risk, and you can look at some of these these things, because sleep apnea causes high blood pressure, all kinds of problems. And the danger is that we have, I know in Canada, truck drivers have to get tested for sleep apnea. It's very dangerous, falling asleep while they're driving, all kinds of issues. And so we think snoring is a social problem, or it's just a social problem. And snoring is when the tongue falls back in the throat, limits the airway, makes a noise, a little vibratory sound. So it's a little bit of an indication to us that maybe something might not be right. And then, of course, if the tongue falls all the way back, it can block the airway, and they call that obstructive, because it's an obstruction, sleep apnea. And we can help identify that. And then when we do identify that, we want to get people to the right physician that can help them. But dentists do have a role. We do have a role in this disease if it's mild or moderate, and that is in place of or in lieu of the CPAP machines that you might know somebody who wears or have heard of somebody who wears one of these. In lieu of that, we can make a jaw appliance, a little appliance that fits on the teeth. Sometimes it's under a couple $1,000. You can make this piece, and it can pull the lower jaw forward. And patients who travel a lot, who maybe can't wear the CPAP machine, this can be a very effective tool, but it requires a sleep study first. Before you make the appliance. And this is our home sleep device. It's like a wristwatch you put on your wrist with a finger probe and then a little piece that fits on the sternum, and it measures about 8 different features of your sleep while you're sleeping and lets us know if you have sleep apnea. And then appearance, I'll spend very little time on this, but this is a person who basically was in his late 60s and just had a little tiny bit of minor tooth movement, one crown, and some bleaching. And we know that if people have problems with the way they look, it can cause psychosocial stress, the ability to really mingle, and it can be a real problem. So we evaluate appearance as well, but it's not the focus. The focus of the integrative oral medicine in our practice. We surely address all these concerns. We have an in-house laboratory, and we can do beautiful cosmetic and aesthetic work. However, again, we want to make sure that the people that are walking around like that are healthy. So before I close, I want to key on one thing, and that's one of the pollutant issues, and that's mercury, because there's a lot of questions out there about mercury. There's some new testing available to me. It's under $400, and it's a test that I can do that tells me a little bit about the kind of mercury that you might have in your body. And there's a positive correlation between the amount of blood mercury and the amount of fillings that people have in their mouths. And we know that the mercury does a couple things. One, it causes endothelial dysfunction. That's that dysfunction of the lining of the blood vessels. In addition, it causes a decrease in nitric oxide. So that's another thing that mercury does. So we have a handout on this as well in the back, but we can take a test. It's a blood, hair, and urine test. It's pretty easy to do. And we can test whether the mercury is coming from a fish source or a natural source or an inorganic source like silver fillings or some other environmental exposure. There's other ways other than just silver fillings. And so we can learn how much mercury is in our body, how well our kidney clears that mercury, and if it's accumulating or not, and if it's harming us. So that's a nice thing. So this patient had 7 big silver fillings, came down to me from Chelsea, Michigan, had 7 big silver fillings. And so we went ahead and took those silver fillings out and replaced it with white fillings. And I really want to make sure that you understand, if you go to your dentist and you ask your dentist to take out your silver fillings and put in white fillings, do not expect these white fillings to be problem-free, because they're not. You can have increased sensitivity. You should be very well informed before you do that about what can happen when you take these out, although it can be done very nicely. And so here's the mercury chart, and I want to focus on the middle graph right here, because this is the mercury, this is the amount of inorganic mercury from silver fillings. She was in the 95th percentile of mercury in her blood from these silver fillings when she came in to consult with me. This is mercury from fish, and you would expect very little because she was basically almost a vegetarian, but not quite. And then this is total mercury in the body, but this is the graph that I want to focus on. In the next slide, after we remove the mercury, our pre-level concentration is now in gold. So here's our pre-level concentration, and here's the post-level concentration, now in blue. So what you can see is what the red box says is we reduced her inorganic mercury by 96%, just by taking out those fillings, replacing them with white fillings. This person had no chelation. This person had no other support other than just taking those out, waiting for 6 months, letting the body heal itself. She was on a predominantly plant-based diet. which wasn't a significant piece, but it helps. And it was really a nice result for her. So this is the kind of things we can do with the mercury. But I think we should test for it. As Dr. Khan said before he left the stage, there's a huge craze about coconut oil. So I really wanted to set the record, at least the record in my office, straight about how we feel about oil pulling. People swish with coconut oil. And so this is a picture of a patient that's swished with coconut oil. And the right side is her pre-swishing picture. And the left side is her post-swishing picture. And she swished for 20 minutes a day for a month. So that's a pretty big time commitment to do that. And if anybody comes to me and says, I have this great thing in dentistry and I think it makes my gums better, I would just say, show me the bacteria data. Just let me see the bacteria data. Let me see the preoperative test and the postoperative test. And one of the things you'll learn if you see one of us dentists that are kind of practicing this way, we like to have some metrics or some measurables to tell us whether we're really doing what we think we're doing. And so here's her gum disease chart, and you know from the last one you saw that we're looking for the red dots. She was already pretty healthy when she started. She had 3 areas of bleeding. Her post-test, she had 6 areas of bleeding, so she had a little bit more bleeding. And that's bleeding that's calibrated by our periodontal therapist, and so it's a very specific type of bleeding. This is not the kind of bleeding she would notice at home. It's from this gum measurement. And then here's her bacteria chart from this is her pre-swishing experience, and this is her post-swishing experience. But I don't think it's hard for you to see that there's really not a lot of movement in the bacteria. So what that means to me is oil pulling might make someone feel better. It might make them, feel better in other ways, but it really hasn't proved in my practice to do much to the bacteria that are really causing these diseases. So if you're healthy, you can oil pull. If you have gum disease and you're at the risk of losing your teeth, please don't do that because you're going to need something else and something a little bit more targeted. So we have risk assessments, and these risk assessments are designed to ask you 6 or 7 questions, 10 questions maybe, and for you to have a feel for what you might have. Might you have gum disease? Might you have cavities? Might you have bite disease? Might you have oral cancer? And these are what's laying on the table out in the back. Could you have sleep problems, or could you have problems caused by biocorrosion? So these risk assessments are here. You can take them home. If you'd like one, you can fill them out. You can email us. We're very open to discuss it. So I hope I've enlightened you a little bit about why we would recommend a health and plant-based diet and wellness protocol. We think it's fantastic. It's absolutely beautiful for us to work this way, and we feel great about doing that. And we do have a keen awareness about how a lot of things affect whole body health, and this is just a little brief smattering of things that we look at. But we love the integration. I work quite a bit with Dr. Khan and working more with Dr. Khan. It's very, very rewarding. And this is really what we're trying to do. In addition to cosmetics, this patient has a dramatic change in the way her smile looks, but I can tell you she also has a dramatic change in her health. And this person went through a lot of transformative things that began with the mouth, and we started that campaign for her. It's very, very gratifying. I also want to let you know that there's some other practitioners in the area and friends of mine. If we could have the house lights up a little bit, and I'd just like for Ed and Dr. Borio to stand, and Dr. Nancy Hartrick to stand. And I don't know that Dr. Jeff Grabeel made it, but these are 2 of my colleagues that are also on the wellness path in their practices and treat their patients in a similar fashion. And then Dr. Borovich is in the building that I'm in. So there's other opportunities for you as well. So I want to let you know who won the book. So take a look at your recipe. And if the title of your recipe is in all capital letters, you're my book winner. Who has the recipe in all capital letters? So if the title of your recipe is in all capital letters, there should be 5 of you in the audience. Meet us at the back. After we're done, we'll answer some questions, and then I'm happy to personalize. In the book that you're gonna get is Joel Kahn's book on the whole heart solution. So meet us in the back, please. Thank you. Want me to field any questions or wrap it up?
Yeah, we got a few minutes for some questions. Anybody, please?
Would you recommend a certain toothpaste and/or mouthwash?
Yeah, the toothpaste. The big concern about toothpaste is if you have a cavity risk, then I would prefer that it be fluoridated. Now, the fluoridated is only hitting the tops of the teeth. You're not drinking it like the water, right? When they put fluoride in our water, you have to drink it. You don't have a choice. The fluoride in toothpaste, you're swishing on the tops of the teeth and you're spitting it out. If you don't have a cavity risk and there's no history of cavities for you, then you can use any paste you want as long as it's low abrasive. We have an abrasivity chart. You'll be amazed at some of the health food stuff that's loaded with sugar and abrasivity. So you have to really be careful because cavities feed on sugar. And they can even use some artificial sugars, but they can't use xylitol. So xylitol would be our powdered sugar of choice. And if you're going to put you can bake with it, you can rinse with it. The lollipops that are on the back desk on our table are xylitol lollipops. They're very safe. And it's also good for children. However, the caveat to xylitol is you can't let your pets get it. It's very harmful to your dog. And it also doesn't do anything it still satisfies that sweet craving. So when somebody's around something that doesn't have xylitol in it, they're still going to crave that sugary substance. So any paste is fine. Fluoride, yes or no, depends on your cavity situation. Abrasive, low abrasive. And all the pastes have what they call an RDA value. It's a relative dentin abrasivity, should be 70 or below. And if the manufacturer's not proud of it, they don't want you to know. Yeah, hydrogen peroxide is a wound debridement agent, so it can be a little bit caustic, and it does have some antibacterial properties. However, in a rinse form, it might not be as effective as some other chlorine-based or some other disinfectant products. So we don't really recommend using hydrogen peroxide as a rinse. However, there is a therapeutic modality that we use where we use it as a gel. And it's a little bit different concentration, and it's made a little bit differently. So to go to the store and buy hydrogen peroxide, it's probably not the best. It's probably not the best strategy. If you had a lot of bacteria in your mouth and you really wanted an antibacterial rinse, there's one out there called Closis, and Closis is a stabilized chlorine dioxide-based rinse, and that would probably be a little bit better. Again, with the rinses, if you have an acid problem, many of the rinses are very acidic. Some rinses on the market are it's like swishing with Coca-Cola. So you want to be careful not to get a real acidic rinse, and we have lists of rinses that are pH balanced and that are above pH 7.
What about baking soda for your teeth?
Perfect. It's absolutely perfect. Baking soda, the abrasivity value is 0. That's a small number. And it's perfectly fine. It feels gritty, but it dissociates in water immediately as soon as it hits the toothbrush, and it also neutralizes acids. I'd have no problem. However, it doesn't have fluoride, so if somebody had a cavity problem, I would want them to use something that either had fluoride or some other tooth remineralizing agents in it. It doesn't have to be fluoride. We have other alternatives now to that. Some practices are totally fluoride free, and I'll tell you, it's a real dilemma for me, because if I have somebody come in and they have a child that has a lot of cavities on their teeth, there's nothing more effective that I can do than to help harden that tooth structure with some of the fluoride products. And I'm sorry it's that way. It just is. I have people in the holistic health community that bring their children to me that are losing 5 and 6 teeth, and it's just not right. So, we need to evaluate that and be careful. If they're at risk for disease, they need protective measures. If they're not at risk for the disease, go wild.
You briefly mentioned cost. If you don't mind, could you address a cost-related question for me? I've been self-employed for some years now, and matter of fact, I have a sister in the same condition. And I can't lie, since I've been coming out of my own pocket to pay for my own dental work, I don't go half as often as I used to. And I find myself on either the conscious or subconscious level delaying, and I just am not as proactive with my dental health as I am with my overall medical health. Any cost control advice for those of us who are self-employed and don't have that employer-supplied dental insurance?
Yeah, we have a hard time with this question. We have to be sensitive to the amount of money that things cost. But I also know, we're in an area where almost everybody has a cell phone. We have vacations. We compete with, and what you're really challenged with is learning the value of what the dental health issue is so that we can put it and prioritize it in our lives. Most people think teeth are kind of optional. I mean, they're really not optional. I tried to share that for a number of ways. So I am sensitive to the cost. And as a matter of fact, using risk-based analysis for trying to treat our patients, it allows us to do things like this. If you come to the office, and if you came to Ed's office or Nancy's office or Jeff's office, and you were low risk for cavities, we might move your x-ray frequency. You know how the dentist takes x-rays every year or every 6 months? You know why they do that? Maybe because their insurance company covers it. That's why they do it. Do you really need them that often? I don't know what you need. It's based on your risk. So what the risk-based practice can do is not only be sensitive to your cost, but cut away the things you need, or cut away the things you don't need, and provide the things that you do need. Then the big question becomes, what do I need, and now how can I make it affordable? Because that's a problem. And I can tell you, restorative dentistry, putting the parts and pieces back, can get tremendously expensive. I have patients who spend upwards of $50,000, $60,000 sometimes in their mouths. But I have 80% of my patients spend less than $500 a year. All right, and so if I do a risk analysis, if Veteran Nancy does a risk analysis, we could probably almost predict how much money it's going to cost you to keep dentally healthy. And many people are worried about it when they don't have to be, because they really don't have big needs. It just hasn't been assessed that way. And what I think we're worried about when we go to the dentist is, what is the dentist going to find? Right? Because it seems like we're always looking for something, right? Looking for something. We're trying to look for reasons not to do work, not to do work. And so we're very sensitive to that. And it's a great question because, you know, the cost of healthcare is getting ridiculous, right? In all aspects. And then another thing to let you know about is most dental insurances have been pulled back. So dental insurance is, and I'm not an insurance expert, and I got to be really careful because I have to be careful about what I say about dental insurance. But in my practice, I can tell you this, how I feel about it. I don't participate with dental insurance companies. In other words, I'm out of network. So, and many of the physicians that you're going to see here are out of network. We can't afford to be in network to provide the kind of care for our patients that we can care. However, my goal for you is to figure out how to give you the least amount that you need to stay healthy and make it affordable for you. And the network providers have their unique challenges, and I think that it's a big dilemma right now in healthcare, and many patients, many people in our community, it's one of the first things to go in your benefits plan is your health insurance and your dental insurance, and they're surely limiting it, making it much smaller and smaller.
Is there a role for Listerine?
There is a role for Listerine, however, it's very acidic. So if you're going to use Listerine, we have a program where you use Listerine in combination. You know, it has some essential oils, has a lot of alcohol. You can get alcohol-free as well. But we have a program in the office where if you're going to use Listerine, you have to follow it with something else that neutralizes it. So we have a total over-the-counter healthcare protocol, but you have to, you know, we have a disinfectant, we have a neutralizer, we have a tooth hardener, then we have another disinfectant, and then we have another tooth hardener. And it needs to be done in a little bit of an order, because if you just rinse with Listerine, it's very acidic. So if you have an acid problem, not such a good idea. And if you don't have a germ problem, why do you need it? If you want your breath to feel good and smell good, go get a xylitol mint. Go ahead.
How does dairy affect dental health?
I'm sorry? How does dairy affect dental health is the question. It's sugar, so it's sweet. So never put a child to bed with a milk product in their mouth because it's sugar. And so you can cause a tremendous amount of tooth decay. There are some tooth remineralizing products made out of casein, which is a cow product. So dairy could be a double-edged sword. But we're definitely recommending, if anybody has children, no sweet sugary juices, nothing in the bottle but water, or whatever your pediatrician might recommend, but nothing sweet or sugary until we know, you know, and just never. It's easy. Paul, are you getting close on time?
What, two more questions then, all right?
Go.
Who should drink pH balanced water above like 8?
I think anybody that has an acid problem. I've been measuring whole body pH through saliva and urine for almost a month, and you can see that if you live a little bit on the wild side, eat the wrong food, drink the wrong things, you'll change your urinary pH. Your saliva pH the salivary glands are pretty smart, and they're designed to try to neutralize whatever you put in your mouth that might be bad. So it's a neutralizing type thing. But the pH water is surely not going to hurt you. However, take a pH paper and put it in the pH water that you buy that's supposed to be 10 or 10.5 or 9.5, because most of them are still under 8. And I've been testing them. I've been looking at them. But pH water, I have no problems with that. And alkalinizing the system is a great thing. But do it with foods. If you eat a strawberry Skittles, and everyone knows what that is, right? Strawberry Skittles, that's a little candy. The pH will go down to about 5. And if you eat a strawberry, the pH will go to 10. So if you want to acidify or if you want to neutralize the mouth, or just eat some berries or eat something healthy, and the pH will go up. But the pH water I have no problem with.
Your thoughts on essential oils such as clove or doTERRA's On Guard?
Yeah, there's some nice plant-based disinfectants that I'm starting to research right now with doing the bacteria studies. Biocidin is a biobotanical drop. It has all of the essential oils. I think there's great promise in that, and they're starting to use it now for Lyme disease and for some other issues. So there's no question that used properly in the right formula, that can be very good. We use oil of oregano vapor for the nose and eucalyptus for yeast infections. We use some essential oils for various things. Tea tree oil, you can get it in toothpaste, CoQ10. A lot of these things are additives, but they need to be, dentistry and dental care, just like your health care, needs to be personalized, right? It needs to work for you. So when you hear your buddy say, well, you know, I'm supposed to have so much of this per day, that might not pertain to you, might not fit your genetics, might not fit your, your particular needs. So get evaluated, and these plans are personalized, and that's why you have to, that's why you have to be evaluated. I'll take one last question.
Regarding amalgam removal, do you ever recommend chelation, or are there any like other providers in the area you work with that do oral or
Yeah, I'm just not experienced in chelation. I mean, I'm not experienced enough to have enough patients in the integrative oral medicine practice to have them go and have that chelation. So I'm going to have to defer that question to another expert. But I do refer. If I have somebody with a metal toxicity issue, I would do what I could do. But there's lots of things in the nutraceutical companies, Metagenics, and some of the companies that have MetalloClear, and they have different things. And so I give the patient options. It can be very expensive, and so we give them options. And the beauty is we have a test, so we could retest and say, did what you think you were going to do, was it effective? And if it was effective, I'm great with that. If it's not, we might need more help. Okay, you guys have been a great audience. Thank you. We're going to be around. My team's going to be around. I need to see the people who have won the books, and I'm happy to stay. I have patients in the morning at 7:30. I'm happy to stay till then.